glad to have you joining us on this Friday morning. And joining us now in studio, we have Fabio Rango, who is a pharmacist with Shoppers Drugmart. Welcome. And Dr. Angela Cheung, who is Director of Women's Health Program, Osteoporosis Program, and Center of Excellence in Skeletal Health Assessment at the University Health Network at the University of Toronto. Welcome to both of you.
Thank you.
And we are specifically going to be dealing with osteoporosis today, a term all of us are familiar with in some way. We all think of it, though, as the little old lady disease, really, when we think about it. Specifically, when we talk about osteoporosis, what are we referring to?
Well, it's really a bone problem, and the bone sort of is a living tissue. It will regenerate itself with activity, and one of the things is that as we age, and especially for women, as we lose estrogen, the structure of the bone is not as good, and it is porous, and so osteoporosis is really porous bone.
Now, that's interesting because you said as we age. Now, when I hit menopause, one of the things was a very low risk of breast cancer. So my doctor said, you know, take it for a while. You're dealing with hot flashes and everything, but this will also help you with the bone loss. So is it something, because we went backwards and forwards over whether hormones were good or bad and the relation to, you know, increased chances of breast cancer, but is it something that aging women could think about if they were, is it good in general? Does it help to have, I wear a patch for, is it going to help me maintain my bone strength? Because you can't really build it up again, can you?
In unusual circumstances, you can, but in most circumstances, it's hard to. Certainly, if you have menopausal symptoms, like hot flushes or other symptoms, you can use hormone replacement therapy, or now it's called hormone therapy, for a short period of time, using as low a dose as possible. And with that can help your bone.
Now, you have done there's been a survey done, Osteoporosis Canada, in partnership with Shoppers Drugmart, putting together this survey, surprisingly revealing that only 5% of the respondents in the survey are knowledgeable about osteoporosis. Yet, it sounds like all women specifically, and so, I guess men too, but women specifically, are going to have to face the reality that they could be dealing with this at some point. For a younger woman approaching perhaps perimenopause, getting closer to menopause, at what point do you start really paying attention to your bone health and doing what you can to prevent the onset of osteoporosis?
Well, it's never too early to start talking about bone health. Everything that we do today can help reduce the risk factors of getting osteoporosis or even a bone fracture in the future. So it's never too early. Even if you have osteoporosis, it's never too early. We can always start doing things today to help reduce those risks. And yes, I mean, it's 1 in 3 women will experience a breakage of a bone as a result of osteoporosis. So it is a really big issue, and it was surprising that not very many people are aware of this, and raising the awareness is one of the key things of today.
Okay, so obviously one of the guidelines would be calcium, taking calcium. But there's different kinds of calcium. So how many people actually come in and ask you as a pharmacist to explain to them which, because there's a lot of bottles, I know, I've looked at them, and how much you should be taking and how you compare it with what you're eating in your diet. Are there any risks associated with taking too much calcium?
So definitely, there's a lot of questions relating to calcium. What I always tell my patients is that the key thing is if we can get everything we need from our diet, that's the best way to do it. So eating calcium-rich diets, you know, things like salmon, green leafy vegetables, dairy, almonds, those type of things all help with our calcium intake. If our calcium intake isn't enough through diet, then supplements are always important. And there's a lot of different supplements out there. But the key is how much calcium are you getting in any of the supplements you take. So calcium carbonates is a typical calcium, and that has the most amount of calcium per tablet. So it's the easiest way of taking calcium, but it's not best for everybody. So people with low acid levels in the stomach or taking medications to reduce those acid levels, calcium carbonate would not be a good choice for them. And a different type of calcium, such as calcium citrate, would be good for them. It's not that one's better than the other, it's just the amount of calcium that you're going to absorb. So those are the questions you want to be asking your pharmacist.
And how do we determine, do we go for regular testing? How do we know how much calcium? Maybe we're doing really well. Maybe we're not doing as well as we think we are.
So there are calcium calculators that you can sort of access. You can find one on Osteoporosis Canada website, which is osteoporosis.ca. Or you can find one at our University Health Network website, which is osteoconnections.com. And I would say that it gives you an idea of around how much you take a day, and then it actually helps you adjust in terms of how much supplement you need. And calcium and vitamin D are sort of interesting things. Like, you need enough. Not having enough is bad, but too much is also bad for you.
Well, that's my question. So what's considered too much, and what happens if you have too much? How would you know?
So we're recommending at Osteoporosis Canada that a postmenopausal woman or women and men over the age of 50 get about 1,200 milligrams a day. And that is diet plus supplement. So it's not taking 1,200 of supplement per se, but that has to be individualized because, there are people who have medical problems that need more, and there are people with medical problems that need less. So to give you an example, like people who have kidney stones, you may want to take everything in diet rather than supplement. Whereas in someone with inflammatory bowel disease, like Crohn's or ulcerative colitis, you may need to take more because you're going like 12 times a day to the bathroom. So I think that needs to be adjusted as well. But in general, about 1,200 milligrams
per day.
And what about, some people more susceptible than others? Like if I look at my grandmother and she had osteoporosis, does that put me at a greater risk?
For sure. So if you have the genes, and we know genes sort of have a lot to do with our makeup. So if you have a family history of hip fracture, whether it's in your mother or father for that matter, or see a family member with a hunchback, those are risk factors. And certainly if you know that they have osteoporosis, that's another risk factor as well.
Sharon has had a hip replacement.
Yes. But I had really strong bones.
Really?
Yeah. Because and how I found that out was the doctor, there are two kinds of hip replacements, one's cemented, one's not cemented. And a non-cemented, you need really strong bones or it can splinter the bone.
So you've got strong bones.
I've got strong bones.
But you needed a hip replacement.
Well, that's because arthritis. That's not osteoporosis. That's arthritis.
Osteoporosis, is it a disease? Osteoporosis, is it considered a disease?
Yes, it's considered a condition, it's considered a disease, and it's a very common issue for men and women over the age of 50.
Really? So I didn't realize it was classified as that. I thought it was just a condition of normal aging. But it's not, it's something that you can prevent right from ever starting in you?
Yes, I think that's something that we can do as well. So you can say, 50 years ago that dying of an infection is natural cause of death, and that because we didn't have penicillin and we didn't have antibiotics, right? So, we are in 2016. We should be doing a lot better in terms of preventing fractures and helping people live healthy, functional lives with high quality up to very old age.
Well, one of the stats you found in the survey really surprised me, but each year in Canada, broken bones caused by osteoporosis are more common than heart attack, stroke, and breast cancer combined for women over the age of 50. That's a pretty outstanding number. That's huge.
Yes, and it's not only found in Canada, it's actually found in the U.S. as well. And I always say that musculoskeletal diseases is sort of the last frontier in medicine because, people pay so much attention to heart disease and cancer. But if you look at the stats, it's really, the number of fractures is staggering.
And are people, many of them, not even finding out they have osteoporosis until the point of fracture?
For sure, that's what we see. So I do acute care in the hospital, and sometimes the first thing that they come in with is a fracture. However, I can say that for those who have had a fracture, they really need to get assessed, because half the people that is in my hospital with a hip fracture, they have had another fracture prior, and nothing was done. So they have had a wrist fracture, a spine fracture, some other fracture previously, but someone said, oh, it was an accident. The floor was slippery, someone didn't, I tripped over something, that was a stupid accident. But it's not. I mean, if you have a heart attack with shoveling snow, you don't say that was an accident.
Right.
No. You just say the snow is very heavy. So Fabio, when you see people come in and they want to know about this, and it's mainly women that take care of the entire family's health, particularly their husbands. What is the difference between how a woman and a man should be treating it, or is there?
I believe that both should be treating equally important. However, men tend to have thicker bones, so we don't really see as the complications happening as often in men. However, it's still 1 in 5 males over the age of 50 will experience a bone fracture as a result of osteoporosis. So it's important for both women and men, but women, because their bones tend to be a bit smaller than men, their complications happen earlier.
So if you're looking at a diet then that you're cooking meals for the entire family, what would, you're trying to hit 1,200 milligrams of calcium. So what would be something, like, could you take us through what you could have every meal that would help you hit that target?
Definitely. What I try to tell people is to make sure that they have a diverse diet. So although one item might have a large amount of calcium, don't try to eat that every day. You should try to enjoy life, try to enjoy your food, try to enjoy everything. So, mixing around your green leafy vegetables. There's a lot of different types of vegetables you can have. You can have kale, bok choy, all those type of vegetables have high amounts of calcium. Sprinkling in some nuts. 20 almonds alone will have 100 milligrams of calcium. So as a snack, that will help us, make you feel full and yet give you a lot of calcium. Dairy is also it's the number one, but not everyone can have dairy. And
but almond milk would be that would be high in calcium. If you
would have high amount of calcium. Dairy would have more calcium, but almond milk would have calcium as well. Orange juice has calcium, calcium citrate. So there's the key here is to have a diverse amount of foods, and every day you'll enjoy it, you'll eat it, and you won't even realize you're getting all the calcium.
Something I want to point out as well, just I'm thinking as you're talking here, and when people are you're not feeling sick, you're not having any health problems, but you want to address something like such as the calcium in your diet or something, maybe you don't want to go to the doctor, but a pharmacist is an excellent frontline healthcare provider to go and talk about these things with, to get some good solid advice and some guidance, right?
Well, we're trained and accessible, and that's the key. And we're always a frontline agent that can refer to the doctor or so forth. But for just simple questions and that, coming in to see the pharmacist, phoning us, a lot of us are open, extended hours. So, it's a great resource to use, and we want to make sure that women have that resource because it's an important issue.
And also how it relates to, you have all the medication history right there in front of you.
Correct, yes.
Yeah.
Well, it said also from the study, as of 2010, the overall yearly cost to the Canadian healthcare system for treating osteoporosis and the fractures it causes was more than $2.3 billion. That's
staggering, really.
Staggering, yes. Well, that would be what you do with
stop.
osteoporosis.
I know, I put it out there, you couldn't leave it.
I couldn't leave it alone. Is a multivitamin, for people that don't like to take a whole lot of pills every day, does a multivitamin give you enough of a supplement?
Multivitamins, because you're trying to incorporate everything into one pill, is not going to give you a lot of calcium. There is definitely calcium in a multivitamin, as long as you take a complete multivitamin. A multivitamin will have just as regular vitamins. Complete indicates that it's adding in minerals, such as calcium, into the vitamin. But you're only going to get so much calcium in there because it needs to fit in all the other vitamins. So it depends on what your diet is like. So multivitamin may be great for some people, but some people who are not taking enough calcium through their diet will need to take a specific calcium supplement to get enough calcium in their diet.
All right, well, thank you very much for telling us about this. And it's osteoporosis.ca is the website.
That's right.
There's
Mm-hmm.
information on there. And a reminder, you can always talk to your pharmacist. They have great advice for you, helping you navigate all those shelves of vitamins and
Yes.
what you
That's where I send my patients to.
Click the channel subscribe button for full-length interviews and more from What She Said here on YouTube.